KXL News Time, 6:20.
Experts on the 20s now, and it's sponsored by the Oregon Nurses Association. And here's a statistic. Get this. 1 out of 4 people listening right now to us has a likely risk of developing diabetes in their lifetime.
Among the side effects is diabetic neuropathy. It's a type of nerve damage that can cause pain, numbness, even death. With us now is Dr. Joshua Johnson. He's a neurologist with Providence Brain and Spine Institute. Dr. Johnson, good morning.
Good morning.
This being Diabetes Month is a good time to ask, why is diabetes approaching record levels?
Well, diabetes is a very common problem, as you indicated, in the United States, and that probably has something to do with the way Americans eat and the way that Americans don't exercise. Not exercising and certain kinds of diet can increase the risk for diabetes.
And so what is it about the blood sugar levels that cause so much damage to the body? How does that work?
Well, there are different ways that injures the body, and it depends on which organ you're talking about. But generally speaking, the high glucose levels can injure the arteries, and the arteries go to all the organs. And when the arteries are injured, when there's clotting in the arteries or buildup of cholesterol, that causes reduced flow, and that can cause damage to the organs.
Oh, my goodness. What about bad circulation? Does that make you a mark for diabetes?
Not necessarily, but poor circulation is a problem from diabetes, and so people can have poor circulation to their heart, to their brain, to their limbs, like to their feet, or to their kidneys, and that causes damage. And
how often does that result in an amputation? You hear about people that have to get limbs amputated because of it.
Sure. Not often, but people with diabetes are definitely at risk for that, and the reason for that is that if they get a cut, for example, or some kind of injury to their foot, and the circulation is poor to the foot, then the cut may not heal, and eventually it may need to be taken off.
You know what we've been hearing you say in the last minute or so, Dr. Johnson, is that in many cases we are responsible for our own diabetes because we've done it to ourselves.
That's one way to say it. I wouldn't say that to a patient probably,
right.
But it is true that behavior definitely increases the risk for diabetes. Having said that, there are people who have inborn problems with blood sugar control that really has nothing to do with how they behave.
All right, so for the people that it's behavior caused, what's the message?
Well, a good place to start if someone is concerned about diabetes or has diabetes or prediabetes is their primary care doctor. A primary care doctor is really expert at managing blood sugar control problems, and they would probably give advice like increase your activity level and change the diet so that you don't eat so many carbohydrates. But really the balance between diet and exercise is the key.
It is to so many things. Dr. Johnson, thank you very much.
Well, thank you.
Dr. Joshua Johnson's a neurologist with Providence Brain and Spine Institute here on KXL.